I would like to welcome you all to our virtual panel discussion, Medicine Shortages, Giving Up Finding Solutions, as part of the German Council Presidency. My name is Jens Gobrecht. I'm the Director of ABDA European Representation in Brussels and for International Affairs. We would have liked to welcome you personally in the European Parliament in Brussels, but due to the current situation, we unfortunately had to switch to a virtual format. Before I hand over to our moderator, Ms. Wendelin von Bredow from The Economist, I would like to give you a brief technical introduction to our conference. We would like to get to know you a little bit better and give you the opportunity to exchange your business cards virtually. To do so, please use our chat function and introduce yourself briefly with a LinkedIn or Xing link. I will start right away. You're also invited to join the discussion or to post any question under the Twitter hashtag Medicine Shortages. We are looking forward to a lively exchange with you. If you need technical support or have questions about the conference, please send us an email to europa@abda.de. I'm looking forward to 2 exciting hours, and now I may hand over to our moderator, Mrs. von Bredow. Thank you very much.
Good morning. It's a great pleasure to be your moderator today, even though I would much prefer to meet you in person. I would like to now introduce Matthias Arnold, who is the Vice President of ABDA.
A very good morning from my side. My name is Matthias Arnold. I'm the Vice President of ABDA, the Federal Union of German Associations of Pharmacists. On behalf of ABDA, I cordially welcome all of you to this conference. Headlined, Medicine Shortages, Give Up, Finding Solutions. This conference is part of the association program of German Federal Ministry of Health within the German Presidency of the Council of the European Union in 2020. We are very happy to have distinguished speakers from European Parliament, the German Ministry of Health, the European doctors, the industry, our colleagues and friends from Portugal, the European Medicines Agency and the European Commission. And we are especially happy to have you, the participants joining us morning online, who are interested in the topic as we are. Thank you very much.
Thank you, Mr. Arnold. Now it's my great pleasure to introduce Ortwin Schulte, who is the head of the Division for Health Policy at the Permanent Representation of the Federal Republic of Germany in Brussels, at the European Union in Brussels.
Yes, good morning. Am I audible? Am I audible?
Yes.
Okay, very good. Then good morning from the German Presidency, still in office for some 30 days. And I can say it has been quite a special presidency. The first thing is that the Council Working Party, Health and Pharma, had 22 meetings so far, and it will be some 26 when we finalize our presidency, which makes this specific Council Working Party the Council Working Party that met most often in the presidency, which is also an indication of the role and importance of health policy and pharmaceutical policy in a pandemic crisis. We also had some very special tasks to solve, like finalizing co-decision legislation in only 10 days time, which has been done in July with the GMO vaccines regulation, and also, and very successfully in my assessment, to introduce complete new structures of EU contracts in the vaccines advance purchase agreements. which are now coming to fruition. And I am happy to turn on also my webcam so you can see me. I wasn't aware that this didn't happen. So I continue with the presentation. The German Presidency at tomorrow's Health Minister Council, unfortunately only be held in a video format, will also discuss the Council conclusions, lessons learned from COVID-19, which we coordinated in the last months and which put together language of all 27 member states on the lessons we already learned, and of course also on the lessons we are still learning. And one thing we also hope to finalize in the German presidency, and after yesterday's political trilogue with Minister Spahn, Commissioner Kyriakides and Rapporteur Buzoi from the European Parliament, I'm fairly optimistic we will be successful, is the EU for Health program, the new health program for 2021 to 2027. Mainly thanks to a specific commitment of the European Parliament to the importance of health. It will have an 11-fold budget compared to the last 7 years period. And some new opportunities arise, of course, also accompanied by some challenges in administrating and planning the program. We are also thankful that the European Commission presented very much in time, and we know it was quite a challenge, a pharmaceutical strategy, which gives us an orientation on the pharmaceutical legislation for the next years, and negotiations in the Council on the European Health Union package, which I would say brings a very high add-on to the tasks and mandates of the ECDC, the European Centre for Disease Control in Stockholm, and also a considerable extension of the EMA mandate have begun. And we are hopeful that we can give it to our Portuguese friends with already some indications on what the Council will attach importance to. In that regard, today's conference's topic, pharmaceutical and medical devices shortages, are also integrated in the European Health Union and in the pharmaceutical strategy, as well as in the Council conclusions, lessons learned. And of course, we need some clarification how political principles can be turned into legislation, which are targeted at European health sovereignty. This process, I think pharmaceutical strategy is a good starting point for this process. We also feel, and Commission has announced it for the end of 2021, that the new pharmaceutical innovation agency called HERA, a little bit following the US model in BARDA, will be a very important contribution. And last not least, the German presidency has tabled in the very long-standing and, of course, under computational aspects, very complicated EU HTA proposal, an overarching compromise proposal, which in my impression went down well in the Council. So we hope that we are close to a solution. And as a last remark, I just have to say, and this was also often expressed in the debate in the Council on the pharmaceutical strategy, we really have an ambitious program for the next years in pharmaceutical legislation in the EU, and we need to reconsider resources. I think and experience from some pieces of legislation under German presidency clearly shows it. We have to use, and we are fortunate to have, the qualified majority principle just to achieve something. And as a general note, I think if we were to attain the ambitious goals expressed in the pharmaceutical strategy, we will have to reconsider a bit the normal timelines which we attribute to complex EU legislation. You know that, for instance, clinical studies or the medical devices regulation, or also currently EU HTA, are often projects running for 3 or 4 years, and we need just to economize a bit our working resources, and that means that in a foreseeable future we should be able to finalize some of these ambitious and challenging health projects. But the positive side, and I want to finalize with that, is that the political value of health policy in the EU lineup of policies has grown considerably, and we have a possibility to make use of that historical chance now. Thank you very much.
Thank you so much for this very interesting address. It's now my great pleasure to introduce the first panel discussion, and we'll discuss the very interesting issue of how big is the problem of medicine shortages and what is the impact on patients and on public health. And I'm very pleased to introduce Matthias Arnold, who we already heard from, the Vice President of ABDA, as well as Dr. Peter Liese. He's a member of the European Parliament for the European People's Party. Jutta Paulus, who is also a member of the European Parliament, and she is with the group of the Greens and the European Free Alliance. And finally, Annabel Seebohm, who is the Secretary General of the Standing Committee of European Doctors. So without further ado, I'm handing the floor to my esteemed panelists.
Thank you for the friendly introduction. And first of all, I thank you very much to Mr. Schulte for his keynote presentation, which shed us light on the perspective of the German government towards the increasing problem of medicine shortages. We have already seen several conferences on medicine shortages within the German presidency of the Council of the European Union in 2020. Today, however, we will take a look from the perspective of pharmacists, the group of health professionals that often are underrepresented in the discussions. But we are in the front when the provision of the patients with the right medication is at stake. More and more patients in Europe are affected by delivery bottlenecks for prescription drugs. Therefore, not to act is not an option. The German Drug Testing Institute, DAPI, carried out an evaluation on behalf of ABDA about the extended medicine shortages in Germany. The next slide shows us the results. The next slide, please. Yes, thank you very much. We show some columns, and at first of all, you see the blue columns. They show us the number of drugs in Germany, and you see there's a high level, but it's a constant level. The study is relevated that the first half of 2020, the number of unavailable drugs that health insurers had provided for their insured by way of discount agreements rose to 12.1 million, the red column in the right. The unavailability of medicine is on the rise in Europe and is a tremendous impact on patients. You see in the last years, you see an increase. This is 68% more non-available drugs than in the first half of 2019. There was 7.2 million, and almost many as in 2017. There was 4.7 million, and 2018 9.3 million combined. You see the direction of this curve, and this is dramatically. The next slide shows us the market. The number of unavailable reimbursed medicines has increased almost fourfold within 2 years, from 40.7 in 2017 to 9.3 in 2018 to 18 in 2019 million packages. This means that every 36 medicine is affected. What it in practice for the pharmacists? For 84.8 of self-employment pharmacists, medicine shortages are one of the biggest challenges in their daily work, and there has been rising for years. You see, this answer gave us in 2016 35.5% of colleagues. In 2019, it was 80.8% of colleagues. The majority of pharmacists in Germany spend more than 10% of their working time on finding solutions together with doctors, wholesalers, and patients. 10% of the working time each day. More than 50% of the pharmacists have to give their patients once or several times a less suitable pharmaceutical from or a second-rate product. These numbers clearly show how severe and urgent the situation is. Not only antihypertensive drugs, gastric acid blockers, and pain relievers, but also drugs of depression, epilepsy, Parkinson's are affected by delivery bottlenecks. Pharmacists all over Europe greatly expand their afforded lengths to provide their patients with equivalent medications. For the millions of affected patients across Europe, we also need a European solution. The European Commission new drug strategy is an impact step in the right direction. And I'm glad that the second panel, we will hear more about this directly from the Commission. The first wave of the corona pandemic showed us how sensitively the drug supply reacts to production downtimes, export stops, or logistics problems, especially in Asia. To strengthen production in Europe, a European approach is required that consistently represent our common quality, social and environmental standards towards trading partners all over the world. However, within the European Union, Brussels must give all member states enough leeway in health policy and social law to ensure subsidiarity for regional and local solutions, respecting that member states have the right and the competence to design and regulate the health systems and its financing. So, action is needed to prevent that a medicine shortage develops to a shortfall of treatment. Disadvantages for patients need to be avoided. Next slide. We need to know more about the situation of medicine shortages. What is the national definition? Do we need a uniform definition across Europe? Which medicines are short? Okay. Since when they are short? Until when? Early the knowledge of impending supply shortages is necessary in order to develop timely supply alternatives or to seek therapeutic alternatives. We need diversity in production, manufacturing and storage of critical activity ingredients in Europe, neither oligopolies nor monopolies. Distribution chain has to ascertain a comprehensive nationwide provision of medicines. The COVID crisis has demonstrated once again that the network of many independent pharmacies shows the highest degree of resilience in crisis, ensures high quality care close to the patient. Professional independence and responsibility combined with economic freedom within a legal defined framework guarantees stability and security of care for all citizens. I say, trust in the skills and knowledge of pharmacists creates the possibility of substitution, the possibility of selecting alternative manufacturers or analog active substances, ensures the supply, trust in the expertise of local pharmacists and their cooperation with the local doctors. Prevent that a medicine shortage develops to a shortfall of treatment of patients. Leave member states the right and the ability to provide the necessary of regulation. The COVID crisis has shown once again the logic of internal market must not be applied uncritical to the health care. Pharmaceuticals are not normal commercial goods. Medicines must be available at all times, everywhere. Thank you very much.
Thank you, Mr. Arnold, for this very interesting presentation. And it's now my great pleasure to introduce Dr. Peter Liese, who I can already see on the screen. He's a member of the European Parliament for the European People's Party. So Dr. Liese, please. Dr. Liese, I think, can you hear us?
I can hear you.
Brilliant.
Okay.
Yeah, the floor is yours.
Yeah, I'm a bit surprised, but because I have a different timetable. You are ahead of the schedule, so.
We are ahead of the schedule. Yeah, we're very efficient here.
Yes, yes. I just entered because we have in parallel also a committee meeting of the Committee for Environment and Health. Yeah, thank you for the invitation to this very important event. Shortage of medicine is an issue that, yeah, experts, insiders know that it's a problem for some time. We had a lot of very encouraging events with doctors, European Commission, also pharmacists already before we even nearly understood how big this pandemic is, and the pandemic made it bigger, obviously. That's why my political group, the EPP, we asked already in January that the Parliament needs to look at it systematically with an own initiative report. At that time, unfortunately, the other political groups in the Committee for Environment and Health thought we don't have time, we have other priorities. It was literally said by colleagues from other political groups, the Green Deal is more important than this topic. I was very frustrated and we needed a pandemic to change this attitude. In March, my colleagues said, now we have understood your message. It is important and we make it a priority. That's why in record time, the European Parliament then made this own initiative report led by our French colleague, Nathalie Collin-Österle. And why it is a problem? I think one thing that is underestimated is that pharmacists, highly qualified people, waste a lot of time because of medical shortage. You know, I have seen statistics that up to 1/3 of the work of pharmacists is due to finding solutions when a drug is not available. The same applies to doctors that have to contact the pharmacist and think about the alternatives. But of course, the biggest challenge is for the patients, and they should be at the core of all our efforts. And that's why we need to work. We need to create the right environment for investment inside the European Union. So it needs to pay off to produce pharmacies, basic substances, but also all other elements of the supply chain inside the European Union. And that starts with a realistic but not too negative approach to pharmaceutical industry. You know, colleagues from the pharmaceutical industry know that I'm not always applauding when they make proposals. I'm sometimes very critical. But I think we need a competitive pharmaceutical industry also inside the European Union. And there was a quite interesting discussion yesterday in the German television when somebody said the COVID-19 vaccine, I don't like it because pharmaceutical industry has high sales and the stocks are going up and they earn money. And then somebody answered, would you prefer to die instead the pharmaceutical industry earning money? So I think we need to find the right balance. We need a competitive pharmaceutical industry, but at the same time, we need to control them and give them the right framework so that they also focus on the real needs of patients. And I hope in the pharma strategy of the European Commission and the following legislation, we can improve the situation. And I think we need also a better regulatory framework that it doesn't pay off to look only at the price. So for many years, the tenders mainly looked at the price, and the quality and security of supply were not having the priority that it should have. And that's why personally, and this is also mentioned in the report of the European Parliament adopted in July, I even think if nothing else works, we need a European legislation that if you want to sell a life-threatening pharmaceutical in the European Union, you need to give assurance. And that can be given when you have at least 2 production sites, one of those in the European Union. I don't think the only issue is to produce inside Europe, because also inside Europe, there may be an accident, there may be a problem. But when it's really an important medicine, we shouldn't depend on one plant, not in Europe or in India or China. But I think it is better to have also at least one production site of the basic substance and all the necessary elements inside the European Union, because we have more influence on how they produce. And in cases like we had in spring, when the international traffic, for example, with China and India has been interrupted, it's better to have also some supply inside the European Union. So I hope we are working on this fast. When I talked to the European Commission, they said the pharma strategy will be implemented also with specific legislation in the course of the next 3 years. I think this priority to reduce the shortage of medicine, it doesn't have 3 years before we even think about a legislation. We need to act fast and soon. And I think I made that also clear in a personal meeting with Ursula von der Leyen. DG Sante needs much more staff. They are completely overloaded with work. And we need to prioritize this issue inside the European Union. Thank you very much.
Thank you, Dr. Liese. We will now switch to Jutta Paulus, who is also a member of the European Parliament. Mrs. Paulus is with the group of Greens and the European Free Alliance. Welcome, Mrs. Paulus.
Good morning. Thanks
Good morning. Good morning.
Thanks for inviting me and thanks for having me. I have actually, because this is a really important issue and therefore I have been speaking on this issue on quite a few occasions already. So please don't be offended that on my slides there is still another logo and not the logo from the ABDA. This is not an offense, as I said, but I thought that having the same issue this morning, I might just reuse those slides. Could you just switch to the, yes. As has been already said, the shortages have been flaring up in the last 20 years, and there has already been a resolution from the European Parliament in 2017 calling for a better analysis of the reasons for the shortages and the issue that we should find a mechanism how these shortages could be better monitored and what role the EMA, the European Medicines Agency, could play. Next slide, please. So this is not a new problem. It just got enhanced by the pandemic. Peter Liese has already spoken of the own initiative report, which the European Parliament has tabled and then adopted in September 2020. And the European Parliament has identified 3 pillars: a return to health sovereignty so that we can secure supplies. We all remember the devastating situation in the spring where Europe found out that we could not produce protective clothing, neither active substances crucial for treating COVID-19 patients. Then second pillar, better coordination within Europe. And third pillar, supplement health policies in the member states and return to sovereignty through closer integration. Next slide, please. No worries, I will not read out all slides. So the security of supply, as Peter has already said, should be made a tendering criterion because, as said, we are looking at the price mainly, but not at security of supply. The Parliament has also called for a non-profit pharmaceutical undertaking capable of producing medicines. I'm a bit skeptic when it comes to that because in order to produce an active substance, you also need the basic substances, the basic chemicals, which are today mainly not manufactured in Europe. So you're just shifting the problem one step further down the road, and I'm not sure whether this will work out at the end of the day. But the diversification is much more important in my view, and we'll come to this a bit later. Next slide, please. Yes, we need a more action at European level, because if we have a European reserve of medicines of strategic importance, then we can act much quicker when it comes to outbreaks of certain diseases. I think the current pandemic is pretty singular in what happened in Europe. Usually we are looking at outbreaks of diseases at a very regional level, and for that a strategic reserve at European level can be an instrument to help quicker at the spot where it is needed. I think very important is what we have seen for vaccines right now, if we have a joint procurement of EU member states, then of course our negotiation position is much better because we are speaking for nearly 500 million people and buying medicines for 500 million people and not for 80 million like in Germany, or I don't know, 4 million it is, I think, in Greece. So of course you get better conditions the larger the doses are that you're purchasing. And we need much more transparency when it comes to the distribution chain. This is somewhat cloudy at the moment, and therefore it is much more difficult to assess what events could lead to shortages and what events could lead to not having sufficient supply of medicines and also of materials. Next slide, please. As I said, a closer cooperation between member states could help in supplying medicines, also in securing sufficient amounts of protective clothing and the like. We have seen stockpiling of certain member states, whereas there was a shortage in other member states. This is not very well economic, and it does not help patients at all. So what we are saying is that the EMA, the European Medicines Agency, should oversee a task force and work with member states, with national and agencies, with manufacturers, with all participants of the chain actually, to anticipate heavier demands, to anticipate for shortages, and to be able to act soon. Also, the Parliament called for simplified legislation and more flexible regulatory measures. When it comes to multilingual packaging, I'm not quite convinced whether this is really good, because I mean, I have been in the pharmacy and I know that many patients would be a bit taken aback if their package of medicines suddenly looks differently, if there is a leaflet in Greek or whatever. And so I'm not sure whether this is the right approach, but the Parliament decided as it is. The digital tools introduction is really important, I think, because if we had a digital database of the stocks of medicines and materials which are available in Europe, then we could act much faster. Next slide, please. The key issues. As I said, the monitoring with involvement of different stakeholders, from producers to hospital pharmacists, not leaving out the parallel traders. Then we could have a much better, much more nuanced picture of the situation as it is. At the moment, we have the notification from the market authorization holders, which comes approximately 2 months before a shortage actually becomes vital, but this is much too late. You cannot do anything within 2 months when there is a massive shortage of a necessary active ingredient. And we need a common definition. What is a shortage? The EMA is the correct institution to oversee this, and I'm very glad that the European Commission has outlined this in the pharma strategy, giving EMA a more important role, and I hope this will go along with more staff and financing, because new tasks need new resources, of course. Next slide, please. Diversification, which has been already said, I would like to make the leap to one of my other political issues. I'm working a lot in energy policy. And when it comes to the operation of electrical grids, there is the so-called N-1 criterion. So if you're operating a grid, you have to prove to the authorities that regardless which part of your grid fails, be it a transformation station, be it a power line, you have to prove that your grid remains stable. Why don't we use this approach for the diversification of supply chains? As a market authorization holder, you have to prove that if either part of your supply chain breaks, you have an alternative. So you have not only one factory producing the active ingredient. You have not only one logistic partner standing ready to transport your medicines. If we could apply this, if we had this diversification, then security of supply would be much better than it is today. And we need an action plan for access and affordability. I think it doesn't paint a good picture of Europe when we have so many patients all over Europe that cannot afford the medicines they need for having a healthy life. Next slide, please. We need European solidarity. As said, joint procurement is an option that we should look more deeply into. We need harmonized management plans, and we need a contingency reserve of medicines at the European level. And we were also calling for a task force of health professionals, which could be sent to regions where there is an outbreak of certain diseases. Next slide, please. We need more competencies for EU for Health. The program which the Commission has brought into the debate was unfortunately cut down by the EU summit in July in the negotiations for the budget. It could be raised again to 5.1 billion at least from 1.7, but of course this is not the 10.4 which the Commission was calling for. And that's a very personal thing. I really ask leaders and politicians, look at the One Health approach. That's also what the WHO said. There cannot be healthy people in an unhealthy environment. The problem of antimicrobial resistance, which everyone who is here in this meeting knows, we know that is closely connected to the overuse of antibiotics in agriculture. We also know that it is connected to the way pharmaceuticals are produced in other regions than Europe. Some of you have maybe seen the documentary on German television about antibiotic production in India, where wastewater is not treated at all, but just running into the next river. And there have been multiple strains of bacteria being identified which were resistant against 10, 15, 20 different antibiotics. So my approach would be, why don't we take up these elements of environmental issues, of prevention of of multi-resistant bacteria into our GMP regulation, good manufacturing practice. I don't have to explain to everyone what this is. If we could take up these criteria, then a production site in India which wants to produce for a European producer would have to adhere to that. In this way, we could tackle this problem through international cooperation. I think we should go for this. Next slide, please. To put it in a nutshell, it's a common European problem. We need solidarity, we need cooperation, we need to take everyone aboard, and it's not sufficient just to return API production to Europe, because without the basic chemicals, we will not be able to produce the APIs either. And as said, the One Health approach will bring more than just shortages, of course, but this would actually help in preventing a lot of diseases. There was a very recent report by the European Environmental Agency which showed very clearly that in regions with a lot of air pollution, the number of COPD patients, of asthma patients, but also of COVID patients, which a severe disease of COVID went up, closely connected with NOx and particulate matter. So that's also underlining the One Health approach. The more pollutants we are putting in our environment, the more diseases we will get in return. Next slide, please. Yes, that's it. If there are any questions, I'll be happy to take them, but I too would have to go back to the ENVI committee meeting pretty soon, but anyone who wants to address me can happily do so using my email account. Thank you.
Thank you very much, Jutta Paulus. We have one more panelist who I would like to introduce or reintroduce, and that's Annabel Seebohm, the Secretary General of the Standing Committee of European Doctors. Welcome, Annabel Seebohm.
Yes, good morning, everybody. Good morning, Mrs. von Bredow, and thank you, Mr. Schmidt, Mr. Arnold, and Dr. Gobrecht for the kind invitation to CPME to participate this morning here in the panel on medicine shortages. Now, as previously stated, medicine shortages are not a new phenomenon, and they're clearly increasing all over Europe over the last years. This has also been reported in the annual PGU surveys, as also already demonstrated by Mr. Arnold in his German picture, but also in the PGU surveys, you can clearly see the high increase. So the problem is significantly aggravated by the surge in demand due to the treatment of COVID-19 patients and additional interruptions in supply chains. Even before COVID-19, there was a daily experience of doctors and hospital and community pharmacists of medicine shortages. These severely limit the doctor's ability to provide appropriate treatment, and they mean in practice that doctors cannot give the necessary medicines to patients. That can lead to possible delays in patients' treatments, to the need to switch to other therapies that could be less effective, to adverse effects and adherence problems. Shortages therefore have an unquestionable impact on public health and most importantly on patients. And they also contribute to increased costs for health systems and potentially for patients. And as previously mentioned as well, they contribute to additional workload for doctors and pharmacists, as they must spend time managing the unavailability, tracking inventory, identifying alternatives, and making decisions about rationing scarce supplies. Now, what is the effective response to medicine shortages? And we think that must take place both at national and at EU level. Now, as EU umbrella organization of doctors, we've been firmly calling medicine shortages a European problem. As such, it cannot be solely solved by national measures. For example, the proposed extension of the European Medicines Agency mandate to monitor shortages and to coordinate a response to them is our long-standing request. And as mentioned by you, Dr. Liese and Mrs. Paulus, also the option of joint procurement, the diversification of supply chains, but also reinforcing the community code have to be revisited. But I guess that's part of the second panel discussion as well, and also looking into the pharma strategy. Now, having said that, prevention and management plans must be adapted to national or even regional circumstances. The role of member states is to implement measures accommodating for the specificities of their health systems. However, and that has been mentioned by you, Mrs. Paulus, these measures must be taken in the spirit of solidarity, bearing in mind that actions taken to alleviate problems in one member state must not cause or aggravate problems in another. Now, I would like to give you 3 examples of national measures which we received from our membership during COVID-19, because at CPME we did a survey during the first wave from March to July, and we received reports also on medicine shortages management. And there were 3 things which were reported. First of all, there were supplementary measures introduced for immediate replenishment of medicine stocks, such as imposing restrictions on the number of prescriptions or limiting the prescriptions renewal. Now, for example, Sweden introduced a limit of 3 months stock of prescription medicines. Then we had practices of repurposing veterinary medicinal products. So in France, a given veterinary medicine that had the same active substance, the same dosage, and the same route of administration as a human one, being in shortage, could be prescribed, prepared, dispensed, and administered in hospitals. And in Sweden, the stocks of propofol were replenished that way by repurposing veterinary medicinal products. The third example, which was given by our members, was the importance of communication, coordination, reporting at national and regional level. So Austria introduced a central COVID-19 pharmacy in all 9 states that functioned as a single point of communication. And these pharmacies were in charge of keeping an overview of COVID-19 medicines and their distribution to the hospitals in their state. And Austria also tightened the obligations of marketing authorization holders to report any problems with a steady supply of prescription medicines. So this concludes my short report, and I'm happy to answer any questions you might have.
Thank you very much, Annabel Seemum. That was very, very interesting. Are there any questions? Are there things the panelists would maybe like to discuss amongst themselves? No, doesn't seem to be the case. I suppose if there are questions, you participants can get in touch with each panelist. Yes, Annabel.
Thank you, Mrs. Fabrero. Yes, one little reassurance to Mrs. Paulus. You mentioned the importance of the One Health approach. You can be reassured we're closely working on implementing a One Health culture, not only in medicine, but also within the veterinary profession, the pharmacist profession, and the dental profession, as we have a sort of an informal coalition of those four professions, plus our students' organization, to push forward the One Health culture.
That's very interesting.
If I may also come in shortly on that one.
Yes, of course.
Yeah.
Yes, very much so.
Being a medical doctor, Annabel Seemum, I think it's very important, not to give the blame to animal breeding and agriculture mainly, because especially in Germany, in Europe, we have a long way to go. But and I applaud the Commission to addressing this, but we need to do a clear assessment how we can reduce antibiotics in agriculture. But in Germany, being a German doctor, I think the biggest job to be done is with the German doctors. In agriculture, the use of antibiotics has gone down dramatically after the AMNOG in 2013. And they have clear regulation. You are not allowed as a veterinary doctor to go for a treatment without doing a proper test. I know that German doctors are not obliged to do any kind of specific test when they administer an antibiotic, and many colleagues do it anyhow, but it's expensive and it takes time. So I think we need to do better here, because when human beings die because of antibiotic resistance, the main point to look at is what is happening in human medicine. There is a responsibility for veterinary medicine, but when I talk to farmers, they always face the question, where are the rules for medical doctors? And I have to admit, the rules are not really clear. So the blame game with agriculture, especially in Germany, is difficult. We need to work together and not focus too much on agriculture when in human medicine so much is wrong.
Yes, please, Dr. Seemum, yeah.
Not doctor, just Seemum. Thank you, Dr. Lisa, for your intervention. I would just like to highlight that ECDC undertook or started a survey last year asking about the attitude amongst different health professions towards antibiotics and prescribing antibiotics. 8,000 doctors across Europe participated in this survey, and we just analyzed, let's say, the answers and published the results and shared the results with the public and citizens. And doctors are very well, in a nutshell, doctors are very well aware of the implications of antibiotics and the problem of antimicrobial resistance. However, they would welcome very much more stewardship programs at national level and more time to accommodate all these types of things.
I would just like add two perspectives to that, or rather three. First, for the agricultural issue, I think it is a bit weird still that veterinarians are allowed to sell antibiotics, which is a large difference from the situation in human medicines, where you have the separation between the physicians and the pharmacists, which is not the case in agriculture. But actually, I'm not sure whether the numbers you just cited about the use having gone down dramatically. We are not looking at daily doses here, because the statistics only look at tons, and it's you don't use the same dose of, let's say, amoxicillin or erythromycin or piperacillin. So you have different active substances needing different daily doses. So by just looking at the tons, you don't have any real information, because it might have as well have been a switch to more potent antibiotics. So I think we should focus that we have a proper monitoring by using the daily dose approach, just in the same fashion as we're doing it in human medicines. Second issue, I have been working in quality management in a hospital, and during the time I spent there, we introduced an antimicrobial action group at the hospital. And so we wrote guidelines for each station, for each profession. So of course the urologists got different guidelines than the intensive care units, and we did seminars for the physicians for making them aware to the issue. We looked at which strains of multi-resistant bacteria were actually present in the hospital at which stations, and so there were focused guidelines for each situation. And with these measures, we managed to lower the use of antibiotics within this hospital by 40%. Which saved money for the hospital, of course. So our director was very happy about that. But I think it was also better for the patients, because also the numbers of multi-resistant bacteria went down a lot. So I think by these relatively cheap measures and relatively, well, it's not really hurting anyone. We can do a lot in a more efficient and more sensible use of antibiotics. Thanks.
Thank you. That sounds really interesting, and I've followed the overuse of antibiotics as has been a big problem in the last 10 years, and it's in a way encouraging to see that there are relatively common sense solutions as the one you just described when you worked at a hospital. Is there anything else? Otherwise, I think I will return the word to Matthias Arnold before we conclude this panel. Anything else? Okay, so maybe.
Thank you very much. I thank you all, and I have to say I have to agree fully with the points you have said, especially, of course, my colleague, Ms. Paulus. She's a pharmacist too. I'm very happy to be here. Yes, we have seen the problems, and I think we are in some aspects we're on the right way, I think. So from my practice, I see a reducing of antibiotics in my pharmacy, of course. We do a lot of points we have to keep in mind, and in the mind of doctors, we set it in the minds of the pharmacists, and at least, and it is important too, in the mind of our patients. They go to the doctor and they demand to get an antibiotic, and often the doctors fulfill this wish. Therefore, we have to with our patients, and we do it every day in our pharmacies, and we open the eyes of the patient and to declare and to show them when an antibiotic is necessary, and often it is not necessary, and we have to look for other way to help the patient. This is one of the parts of our work, our daily work, of course, in the pharmacies. On the other hand side, we saw the problems of medicine shortages, and therefore I think it's a multifactorial problem, and there's no single approach or no single solution for this problem. We have to go a lot of these ways they are appointed, and I think we have to see a timeline. Bringing back the production into Europe, it would be not an approach for the next months. It would be an approach for the next years, of course. To help the pharmacists to substitute APEs, for example, it's this process is working now in Germany. We have a regulatory framework in the moment under Corona conditions. We are able to substitute substances. We are able to substitute brands, for example. And this is not a reducing from the medicine shortages, but it helps the patients and it helps the pharmacies to do their work in a critical time. We have to see this and we have to discuss the problem. You have the possibility to trust in pharmacists, to trust in pharmacies, and we can be a part of the solution of the problem. I think we work in local area. On my side and on my experience, I have a very close contact to my doctors, and it is a great co-working, cooperation between the pharmacy and the doctors, and we work together in order to reduce the problem for the patients. The patient shouldn't learn there is a problem. The doctor prescribe a drug is supply in the supply chain, and we give the patient the drug, and the patient is it's a good feeling, and we need the trust of the patient in the therapy, and this trust in the therapy is the most important step in order to get a good success of the therapy, of course. Therefore, the cooperation between the pharmacies, the cooperation with the doctors is a very important part. And in this moment, I think we have not only the proper in the time, we have only to look to the areas where the solutions, where the steps are going. There is it's a European policies. We need these steps, and we need the EU for health program, of course, and we need the money, of course. And I'm very happy it is not at least 1.7 billion. It's 5.1 billion. It's better than 1.7, but these are not the 10.4, of course. But yeah, it's democracy, and we have to learn and know not all goals we are getting. But at least we have another area. We have the local area. And in the local area, we have to solve the problems too. And therefore, we need the freedom of our local policy to solve the problems in the region. And that is the same important thing. And therefore, I think one of the ground ideas, the European Union, is subsidiarity. And we have to use this subsidiarity. We have to solve problems in the region. We have to solve problems on the member state area, and we have to solve problems in the European. And we have to cooperate together on the way to looking for the best solution. Thank you.
Thank you very much, Matthias Arnold, and thank you to all the panelists for very interesting debates. I know two of you have to run off to a committee meeting, so you're probably very pleased that we are concluding promptly. And thank you, Ms. Seebohm, and I hope you all have a wonderful day.
Thank you very much. See you in Brazil for next time.
Great, so I think we have no break. We continue pretty much immediately to the second panel, which looks at solutions from the European Union and its member states. Which solutions do exist from a regulatory perspective, and which do we think are additionally needed? So with me to discuss this is Dr. Kai Joachimsen, the Director General of the German Pharmaceutical Industry Association, Paulo Duarte, the President of the National Associations of Pharmacies in Portugal, Monica Dias, the Policy and Crisis Coordinating Officer of the European Medicines Agency, as well as Agnès Mathieu Mendes, who is the Director General for Health and Food Security at the European Commission. Thank you so much, and I am now giving the floor to Dr. Joachimsen.
Thank you so much. Thank you, first of all, Prilvan Schmidt and Matthias Arnold and Jens Gobrecht for having me. Probably, I guess, the short summary of my conclusion to this topic would be medicine shortage giving up? No, never. Finding solutions? Yes, we can. So, however, probably there's something we have to consider as well. So first of all, I think most of us agree that shortages are not really a new problem. It's a situation that existed for many years and that has been highlighted by the ongoing COVID-19 pandemic. Like on a laser radar, it has been different before. We never noticed this to that extent. That shows us one thing: it is not an acute problem, but it's a long existing structural problem that has been lingering under the radar of the public and policymakers as well. In that respect, policymakers probably needed that wake-up call to try and really think about solutions and the right targeted solutions at the appropriate level. We really need to see what needs to get done. We got to get it done, and ideally, we got to do it in the right way. It is good that the European Commission is working to find solutions on a European level, but it's also important to look at what can be done at a national level and in close collaboration between nations, within the nations, and then on a European level. When looking at existing regulatory instruments we have at hand to try to solve the existing issues, we should be aware that each and every regulatory instrument is just, in the end, nothing more than a management tool. And it's not a solution to the root causes of the issue, which admittedly are manifold, plenty reasons. And in general, I think the focus should less be on fixing the symptoms. It should be more on fixing and reconstructing the root causes that triggered those issues. I think during these times, it is good to use as an updated example the treatment of a COVID patient. Frankly, because as a physician, you would want to try to solve his or her problems by managing the symptoms, by improving the condition of the patient. However, to really solve the issue would be to just avoid, to prevent from and take action that prevents the patient to even becoming sick. I think that's much more important. When you try to solve the problem of shortages in a sustainable way, you need to look at the root causes, as I said before. You have to try to change the prerequisites that led to the situation. One aspect to look at this is our dependency on other global regions. This dependency stems from the fact that it has become harder and harder to have production taking place in Europe. And here, that in particular applies to off-patent medical products. To do that within Europe in a financially sustainable way, that's simply impossible. There's a price race to the bottom that has been triggered some years ago, which is not compatible with a healthy, functioning competition. That has led many manufacturers to really look for other viable options to keep a product on the market and to consider relocation of product sites to other regions outside the EU. So in order to preserve and redevelop existing production in Europe and to create an attractive environment for new technologies, production in the EU needs to be transformed from, as it is considered now, as a cost factor into what it actually is, into a competitive advantage of this region. We need to define pharmaceutical production as a strategic, viable option that has also economic benefits throughout the region. So in that respect, appropriate and competitive requirements instead of over-regulation will be key. So back to those management tools, simply thinking about those management tools, which is actually the topic of today's panel, we should ask ourselves whether it's good and helpful to coordinate action at the European level and to which degree national measures also can apply and how this all fits nicely together. It is needless to say that a good cooperation between national regulators and European regulators will be crucial. However, national regulators should be in the lead as they are closer to the market, have a closer market understanding, and they interact with all local stakeholders as well. When looking at the ideas of flagship initiatives throughout the European level and by the European Commission, suggested in the pharmaceutical strategy, stronger obligations towards the pharmaceutical manufacturers are being mentioned. Some of these ideas have already been discussed today and broadly as well at the national level already in the realm of the pharma dialogue, for instance, in Germany, or now with the BfArM fix, where literally all stakeholders sit together and assess the situation about availability of medicines. So that is something that should be appreciated and enhanced even. Nevertheless, we welcome the fact that the Commission is willing to look at regulatory flexibilities where they do contribute to the handling of the situation. The willingness to streamline and simplify procedures, as for example, the management of variation marketing authorizations. The switch to new sources of API of production sites can be handled easier in order to ensure the continuity of supply. We can take now lessons learned from the COVID-19 pandemic and introduce the exceptional change management procedure, ECMP, not only for products crucial to treat COVID-19 patients, but to extend the scope to produce to products at shortages in general. A switch to new API sources or manufacturing sites can be implemented much easier, as we've all seen, with the same time ensuring the quality of the products. The envisioned electronic packaging information, EPI, is a good initiative as well that we do welcome, especially as the Commission set out to develop it in cooperation with member states and the industry. This can enhance the security of supply as well. So, for instance, lately a French flu vaccine was imported to Germany and reference was made to electronically available package leaflets. So a shortage, therefore, could be avoided. I think it's a good practical example. A general possibility to have a digital packing leaflet, which can be assessed by QR code, for instance, or scanning the 2D matrix code, would ensure that the patient gets the latest version of the package leaflet in real time. And this is also a big advantage as regards the safety variations that could be implemented very quickly on the spot. So EPI contributes to supply and patient security. So, and still, while all these measures might cure problems, they are not the solution to the underlying case. And maybe one closing remark should probably bring it all together. So I think Churchill said, never waste a good crisis. We are in a crisis. We shouldn't waste it. We should learn and draw conclusions. Thank you.
Thank you very much for a very interesting presentation. Our next panelist is Paulo Duarte, the president of the National Association of Pharmacies in Portugal. Welcome, Mr. Duarte. We can see you. You're on screen, so it all seems to be working fine.
Thank you. Good morning to all. First of all, I'd like to thank a lot the invitation to be with in this meeting today, and to compliment all the members of the panel and the ABDA that invited us to be here, and all the attendees. And first of all, I'd like to address three main topics that I go around. The first one that we need to face to understand there is a problem, to start to solve it. The second one is to use the right tool to solve that problem, like you do with the drugs. And the third is that nothing is granted in our lives, and COVID-19 showed that nothing is granted in our lives. So starting with the first topic, to face the reality is that the unavailability of medicine is a global problem in Europe, and with a huge impact on patients, who are the main concern of our role, the community pharmacies. And shortages have a really impact in patients' life. And we support all the efforts to minimize the impact of shortages on our patients. And we support all the measures that will give pharmacists the power, like we have seen in COVID-19, that can solve the problem of the patients. INN prescribing and dispensing, and even in some cases therapeutic substitution could be some of the key roles that we can work. And maybe if we do that, supporting and the better integration with our doctors, we need to go back and work together. Pharmacists and doctors need to understand that the patient is in the center of our main problems, in our main it's our main reason why we work, and we need to work together to solve their problems. And that's one of the things that we have learned, is that shortage is really a problem. And we spend in Portugal almost 1 day per week taking care of solving problems of shortages of medicines that the patient needs, and we can find it. And even working together with doctors, we can find a solution for that. And that was before COVID-19, and only COVID-19 increase the visibility of that problem. And that's why it's so important now that the authorities and the governments and all the different stakeholders understood that something that we have said before, that shortages will really impact healthcare system in Europe, has now become reality, and the problem emerged with COVID-19. So now that we understand, all of us, that the problem exists, we need to work together to work on it. And then that goes to my second topic, that is to use the right tool to solve the right problem, like we do with the drugs. You don't use the wrong drug to solve the problem of the patient. You need to use the right drug. And going through that, it is important that all the countries, we are not equal, and the different solutions will not have the same impact across Europe. So we need, like the predecessor said, we need a better coordination, a better cooperation in Europe to face this problem, but we don't need more harmonization. We need no more burden of regulation that only impact, and is more administrative tools, and only impact what we can do instead of really helping the patients and the different healthcare professionals to solve the patient problem. So for doing that, we need to go back local and use the communities and the regions and the countries to find the best solutions and have the tools to solve the problem. So better coordination and cooperation at the European level, understood that we have a problem, but leave the system and the healthcare professionals and the different members of the supply chain of drugs, the pharma companies, the wholesalers, the generic companies, and the pharmacies work together with the different national agencies to find the best solutions so we can have the right drug for the right patient. I will give you 2 examples from Portugal. The first one, we create a fast line to have access to the drugs. So every time we have a patient with a prescription that could not be fulfilled, we, together with the national regulatory agency, that is Infarmed, set up a fast line that help us to find that what is the best drug, the best way to supply to that drug to that patient. And if you don't have it, a fast line that the doctors and the pharmacists can work together to solve it. And it's been tremendously effective in finding the solution. The second one that grows up during COVID-19 is going back to where I said of medical pharmacists and doctors working together. And what happened, we find a way of giving more information to each other, to e-prescription. We have around 92 e-prescription already in Portugal, and together with the technology, we've been mainly working together. And each time the patient goes to the pharmacist, I can get feedback or get information back to the doctors, and the doc get information back to the pharmacist, working together. So for daily work, but only and especially to find the best solution for shortages. So, and finally, for the third topic, is nothing is for granted in our lives. So now we understand with COVID-19, you assume that having access to drugs with quality in the safety environment and with effectiveness was granted. So the investment in healthcare and investment in medicines, in the supply chain of medicines, was not a priority across the different entities, and is much more a burden for finance than and healthcare investment to improve the quality of life of European citizens. And now we know that is not true. And with COVID-19, we understood that we didn't make the right investments in the past, and the cost of drugs is not just a cost. It's an investment in the healthcare system and gives a better life and makes people live longer. So with this, what I want to say is that we need to go back and to protect the integrity of the value chain of the drug, from the wholesale, from the pharma industry to the wholesaler to the pharmacy. And you need a better integration of all they work together, all they share information, how they find the best solution to provide the right drug for the right patient at the right time. And instead of split it like we have done in the past, trying to have the best optimization each of the chains of the supply chain, instead of preserving their integrity. And what happened is that we understood now that the supply chain was broken. And each time we need to update and pressure it to a different level of work, it didn't work, or it didn't respond properly to the demand that we had. So we need to go back and understand that this integration, this preservation, this chain that was broken in the past needs to be rebuilt. And that's why, and that should be one of the major focus that you should have in the next time, is to find a way that working together using the proper tools and use the tools that already exist. The pharma companies, the generic companies, the doctors, the pharmacists, the pharmacies, the wholesalers, we are already there, all of us. We don't need to start all over again. We just need to put this system working together again and not take that nothing is granted in our lives, like you admitted in 5 years ago. When we speak with different stakeholders, they say, okay, we don't have a problem with drugs, access is granted, we can have drugs for everyone, so we don't need a pharmacist, we don't need the wholesalers. Sometimes we don't need the pharma industries, and who knows if also with doctors. No one was needed. The system worked and people was well informed to take their own decisions. Now we know that that is not true, and we should, going back to the start, we know that now we have a real problem in the integration of this supply chain. We have a problem shortage in Europe, and this is impacting the quality of life of our concitizens. So we need to change and start to act with a small actions, with a better European coordination, a better cooperation with all different entities, and to avoid just more burden and administrative issues around the stakeholders. We need to find a new way of solve this problem, and I know that pharmacists across the world and in Europe are ready for that, and they want to preserve the healthcare of their patients. So thank you all, and thank you again for inviting us to be here with you today.
Wonderful. Well, thank you very much for your very interesting presentation. We will now go to our third panelist, and that's Monica Dias, and she's the Policy and Crisis Coordinating Officer for the European Medicines Agency. Welcome, Ms. Dias.
Hello, good morning. And first of all, I would like to thank you for the invitation to participate in this meeting today. So I would like to give you an overview of shortages of medicines from the perspective of the European Medicines Agency. So next slide, please. Just give you a little bit of background how shortages are managed at the level of the EU. And to say firstly that shortage of medicines has always been a key priority for the European medicines regulatory authorities. But it is important to mention that shortages of medicines are mainly dealt at national level by national competent authorities. However, because of the increased problem with shortages, and this is before the COVID pandemic, the regulatory network set up the AGMA-EMA task force on availability of authorized medicines. And this task force was established in order to provide a strategic support and advice on how best tackle disruptions in the supply of human and veterinary medicines, and what we could do as a network in order to ensure the continued availability of medicines. And next slide, please. So now going now back to the COVID pandemic, and as I mentioned already in the context of the task force, the network as a whole and EMA as coordinating and providing the secretary to this task force was involved in a number of activities, and many let's say outcomes of this task force, outputs such as, for instance, what was discussed in the previous session, a definition of shortage. This is something that was actually achieved, and we published in July 2019 for the first time a definition of shortage that was agreed within the regulatory network. Now, when the first phase of COVID started, EMA was requested by the European Commission as well as by member states to further increase its involvement in the handling of shortages. And we started a number of activities, and are listed here in this slide. So firstly, we set up the so-called EU Executive Steering Group on shortages of medicines caused by major events. And this steering group is shared by the European Commission. It's composed of members of the EMA, heads of medicines agencies, as well as the European Commission, and communication specialists. And the focus of the EU Executive Steering Group was to give a strategic steer on how to handle shortages during the pandemic. The steering group also met with EU industry associations. So the meetings were preceded with meetings with EU industry associations, including wholesalers and parallel distributors as well. So this was done during the first wave of the COVID pandemic, and has continued. So we continue having these meetings of the EU Executive Steering Group, now of course at a lower frequency. What we've done as well, and this was requested by pharmaceutical industry and agreed by the EU Executive Steering Group, we set up the so-called industry single point of contact system, and this was set up in April of 2020. And this helped prevent and mitigate shortage issues, since we received information for the first time. So EMA received information directly from pharmaceutical companies on shortages of the so-called crucial medicines used in the context of COVID. So this system was set up for a subset of medicines that were particularly important for treatment of COVID patients. What have we done as well? We've continued to use the EU SPOC network. So this is another single point of contact, but now a single point of contact composed of members from each national competent authority. This was one of the outputs of the AGMA-EMA Task Force on Availability of Authorized Medicines. It was established in April of 2019, so was already in place to share information of shortages of critical medicines. And what we did was we continued using the EU SPOC network during the COVID pandemic to further exchange information on critical shortages of medicines used for COVID patients. Another important activity of the EU Executive Steering Group was the development of a common framework for forecasting demand data in the EU. So this was the first time that we've actually worked on forecasting demand data in the EU, and the idea was to have a common framework so that we could then aggregate data from each national competent authority at EU EEA level. But we wanted to combine the data, the demand data from each country in a way that it had been calculated in, let's say, an harmonized way, so that we were aggregating comparable data. Last but not least, it was already mentioned in this panel, the EMA, together with the European Commission and the member states, also developed regulatory flexibilities for pharmaceutical companies. This was done during the first wave of the pandemic, and this was with the aim of preventing or mitigating shortages when they occurred. Next slide, please. So I'll focus now on forecasting of demand data in the EU. So this was based on the lessons learned from the first wave of the pandemic, and in order to prepare for a second wave, what the Executive Steering Group was agreed was to improve how the forecast of demand data for medicines used in ICU for COVID patients, how could we better estimate demand, and also then how we could match that with the supply that would be in place by pharmaceutical industries. So we established an ad hoc working group. This is co-chaired by Emma and one member state representative. And this ad hoc working group worked throughout the summer in order to develop a reflection paper that sets out this common framework for forecasting demand data in the EU-EA. This group has also been tasked to agree on the medicines that should be included in this exercise. So once we finalized the draft reflection paper, it was important to see whether these common principles could be implemented by the national competent authorities. And in order to do so, we started a pilot phase. And this allowed member states to get more experience with the methodology that is described in the reflection paper. And also to then the network to finalize this reflection paper, taking into consideration the learnings from the pilot. So this pilot is still ongoing. It focused only on 5 medicines. So we restricted that to a small number of medicines. And we had a very good uptake from national competent authorities. We had a total of 24 NCAs that actually engaged in this exercise, and this covered a population of roughly 93% of the total EU-EA population. Next slide, please. Now, where do we want to go? And I think what are the solutions for shortages in general? And here I would like to bring your attention to the European Medicines Agency's Network Strategy to 2025. And in particular to 2 of the themes that are part of the strategy. One on availability and accessibility of medicines, and the supply chain challenges. So these are the ones that are most relevant to availability of medicines. Next slide, please. If I focus on some of the goals and objectives, I think one important objective is to identify what are the specific root causes of shortages. And also here we want to differentiate generics or off-patent products, those still under patent protection, because the root causes are generally different. And the idea is to develop strategies to improve the prevention and management of shortages. So what we want to achieve is, as much as possible, preventing shortages from taking place from taking place in the first place. Now we need to identify areas where changes to EU or national legislation could improve supply. So based on the knowledge from the root causes of shortages. Another important aspect is how we can improve coordination of information, but not information of actions. And this is for not only EU regulatory authorities, but also with all stakeholders. And it was mentioned here, all stakeholders need to be involved. And that's what we've done so far. We've always involved all stakeholders in our activities, and also international partners. And this is because shortages tend to be global issues in many cases. And another important objective, and I think this was already mentioned here, it was EMA that should be empowered to provide and provided with sufficient capacity to monitor and coordinate medicines availability and supply. So I will not further develop on that. I believe that my colleague Agnes will expand on the mandate of EMA. Now, if we look at supply chain challenges, so theme 5 of the strategy, here we focus on very much improving the oversight of the supply chain, from manufacturing to importation and final use of the API, and also not only API but excipients and other starting materials used in the manufacture of medicines. So we need to have a better interlink of the information in existing databases so that we can have further information on from the supply chain. And this is something that is lacking at the moment. So digital tools are something that we need to work further on and improve. Now, also already mentioned, we need to improve resilience of the supply chain, and also look at the risks that result from dependency on a limited number of manufacturers and sites. So it's something that we've already encouraged for a number of years, pharmaceutical companies, to have alternative manufacturing sites. And this is so that if there's issue with one site, there is an alternative one that can take over. Of course, that there are costs associated with having multiple sites, and we need to see how we can facilitate this so that pharmaceutical industry can have this in place, so that have measures in place so that shortages can be prevented, and if not, we can as much as possible mitigate the impact. So in a nutshell, and I think this is my last slide, I hope I give you a clear overview on EMA's activities before the COVID, now during the COVID pandemic, and where we want to go. Of course, this is very much linked with the pharmaceutical strategy that Agnes is going to present next. And of course, we work together with the European Commission when developing the strategy to 2025 for the regulated network. And I believe that they complement each other. And perhaps I stop here, and I'll be happy to answer any questions that you may have. Thank you.
Much, Mrs. Dias. That was excellent and very detailed. I think we might keep questions for the end and go immediately to Agnes Mathieu-Mendez of the Directorate General for Health and Food Safety at the European Commission. Hello to Mrs. Mathieu-Mendez.
Good morning, everyone. Can you hear me properly, first of all?
Yes, we can hear you very well.
Yes,
thank you.
Good. So good morning, everyone. First of all, thank you for inviting me in this important webinar on shortage of medicine. The previous speakers have already explained extensively the problem of shortage of medicine. So what I propose is to focus on the action taken back by the Commission, those that are already adopted and those that we will adopt in the coming years. Next slide, please. So what I propose in my presentation is to cover three aspects. First, it is the recent COVID-19 health response package, where we have proposed to increase the role of EMA to monitor shortage. Then I will present the pharmaceutical strategy and in particular the action that we consider to tackle shortage of medicine. And finally, I will explain the study that we are currently doing on this problem. Next slide, please. So let me start with the COVID-19 package. I will not repeat what was said before. The COVID has shown that the problem of shortage is an important one, and therefore on 11th of November, the Commission decided to take the first steps toward building the European Health Union announced by President von der Leyen. And the Commission proposed a package of legal measures that draw the lesson from the current crisis. And in this context, we have decided to change the legal framework to the serious cross-border threat to health, but also reinforcing the crisis preparedness and the response role of the key agency, in particular ECDC and the European Medicine Agency. And so the purpose will be to change our capacity to respond collectively to a health crisis. Next slide, please. During the crisis, EMA has been in the forefront to help in managing shortage of medicine. And in this respect, we have decided to codify in a legal act the activities that were carried out during the first wave of the COVID. And so Monica explained the executive steering group. Basically, we are making now this legal proposal to codify the executive steering group and making sure that we have a group monitoring and managing a shortage of medicine during health crisis. EMA will have this role not only for medicinal product, but also for medical device. They will have also the financial resources and human resources to conduct this work. and to develop IT tools for developing and monitoring shortage, so that we do not work anymore with Excel sheet, but that we have a proper and efficient system of reporting. EMA will also have resources to provide free scientific advice, because one important point during health crisis is to have treatment, and in this context we want to use this legal proposal to also codify the activities of EMA for new treatment. And so they will have a role to give advice to companies, coordinate studies on vaccine, and helping for the conduct of clinical trials. Next slide, please. Let's move on to the pharmaceutical strategy for Europe. On that, last week, on 25th of November, the Commission presented a pharmaceutical strategy for Europe. And this strategy goes really from the development of medicine to the supply chain, through rules on IP rights, through the distribution of medicine, so various aspects along the supply chain, so that we can have access, or patients can have access to affordable medicine, that we have innovative treatment for our patients, and that we have also, we reshape a little bit the future pharmaceutical field, so that our patient will have access to innovative treatment, but also there is less shortage of medicine in the future. And so we have proposed in this initiative a number of numerous actions, but there are a few ones that I would like to mention today. First of all is the evaluation of the basic pharmaceutical legislation. So we will evaluate and change certain provision of the pharmaceutical legislation. And in this context, the ultimate goal is making sure that our patients have more access to treatment, and that we mitigate the problem of shortage of medicine. We will also make a proposal for a European HERA agency, so it's the equivalent to the BARDA in the US, but basically it's an agency who could handle a crisis management in the future. We would also like to have action on the vulnerability of the supply chain and address this problem. It was mentioned by several actors, by several speakers in this conference, that we have realized during COVID, but it was already apparent in the past, that sometimes it's difficult to understand, do we have backup supply? Are we only dependent on one manufacturer for one medicinal product? And we know that the supply chain is more and more complex. The production is all around the world, from the raw material to the finished product, and it's very important now to dig into the vulnerabilities of the supply chain on pharmaceutical and make sure that we have action to mitigate any problems there. Another aspect that we would like to tackle is we would like to develop a cooperation between national authorities on pricing, payment and procurement policy, and to see how it can also help and increase access of medicine to patients. Then in terms of innovation, it's also an important aspect. We need to have innovative treatment for patients. And in this context, we want to make sure that there is a robust digital infrastructure with a European health data space that will complement all the data that we can collect from clinical trials, but all those data that we have, we can collect in real condition. And last but not least, we will also continue to support research and innovation via Horizon 2020. There is another action, I don't know, it's not visible here, but it was mentioned before, the antimicrobial resistance and the environmental aspect. This is also action that we will tackle in the pharmaceutical strategy. Next slide, please. But coming back to the discussion on shortage of medicine, let's be concrete now. What are the concrete actions that are mentioned in the text of the pharmaceutical strategy? We intend to propose to revise the pharmaceutical legislation to enhance the security of supply and address shortage. And in this context, we are considering specific measures, including a stronger obligation for supply on marketing authorization holders and potentially other actors in the supply chain. We are also considering earlier notification of shortage and withdrawal. It was mentioned before. Today we have a notification 2 months in advance of the interruption. It's important to think whether we need earlier notification of shortage by companies so that all actors in the supply chain are aware that certain product may be short in supply in the future. Then it was mentioned several times, it's important to enhance the transparency on the stock. It's quite important to know where are the products in the supply chain so that the authorities, but also all actors can make sure that the medicine are reaching where they are most needed by the patient. And it's also important to reflect on the EU coordination and the mechanism to monitor all shortage and avoid them in the future. And all this reflection should take place, and this review of legislation should take place with a clear timeline. So 2022 is the deadline that we propose in the pharma strategy for action. There are another set of actions that are proposed in the pharma strategy. We will follow up on the European Council request for open strategic autonomy, and we would like to launch a structured dialogue with and between all actors in the pharmaceutical supply chain. So basically, we would like to put at the same table the producer of API with the producer of finished product, public authorities, so that we can have a dialogue, put targets, and making sure that we have a certain strategic autonomy on a limited number of essential medicine. Then another action that we consider is to have action to make sure that industry increase transparency on the supply chain through voluntary process. And also, if the EU for Health program allows it, if we have sufficient opportunity from the funding perspective, we would like to consider eventually supporting the member states in handling a shortage of medicine. But it's very dependent of the EU for Health program. Next slide, please. Let me finish now by saying what we do to analyze the problem of shortage and how it will help us in our action by the end of 2022. It's the study on shortage of medicine that we have started. So the Commission is conducting a study with the help of an external contractor. It's a study analyzing the root cause of shortage, but also potential legislative and non-legislative action. The study is carried out by Technopolis and another contractor. So it's Ecoris. So they are working in the field of a consortium. Next slide, please. And our contractor has been asked to analyze and have an overview of the medicine shortage in the EU, to analyze the root cause of those incidents, and to have an evidence-based assessment of the current framework. So basically, we have asked them to analyze the existing provision of the pharma legislation. So basically, it's the obligation to supply by the marketing authorization holder, but also the current obligation of notification. So we have asked them to look at the existing legal provision so that they will be able in their report to assess potential solution. And so this report will help us to guide us into proposing legislative action to tackle shortage in the coming years. This final report will be available at the end of September 2021, so that the Commission can make an efficient legal proposal at the end of 2022. And in this process of the study, there will be a workshop with stakeholders because we believe, whether it's for the pharmaceutical strategy or whether it is for the study on shortage, it's very important to have the views of all stakeholders, whether it's all actors in the supply chains, but also authorities and also European Parliament and the Council to have a proper and efficient solution. So thank you very much for your attention, and I'm also open to have any question. Thank you. And over to you.
Thank you so much for this very interesting presentation. Very good slides too. If there are any questions by your fellow panelists, now is the moment. Things you maybe want to discuss.
Can I add something?
Yes, of course, of course.
Monique, I have a feeling that sometimes when you are looking again to these problems, it's like to use the right drug for the right problem. And if you use the dose that is too high, you can kill the patient. But if you don't use the right and it's too low, it will have not effect. And I'm concerned that this IT approach and also this view that the supply chain, the main problems, when I saw the slides of ABDA, are mainly in the production of the drugs and not in the supply linked with the wholesaler, the distribution across Europe and going through the pharmacy right to the patient. If you are not at both levels trying to solve the problem, but not using the right tools. So I'm a little bit concerned that we're trying to create something new instead of using what we have to find a solution grown from the patient to the across the supply chain to find where is the problems and then create the data around that instead of starting something new. And this is and go from local to global. That's I feel it, but probably I'm wrong.
Thank you. In terms of IT tools, I think, for instance, one example I can give, and I think Agnes alluded to it, within the USPOC network, we exchange information on shortages of critical medicines, and everything is done through Excel. So you want to have a fast exchange of information, so you need to have the relevant tools to do so. Now, going back to the first wave of the pandemic, and the exercise that we're doing within the network on forecasting demand data, what we've realized is that some member states had already in place the relevant IT tools to be able to monitor stocks across the supply chain, and that information was available to them. But that was not the case in all member states. So we realized that there was a need to let's say exchange best practices and information on what are the possibilities for the member states that don't have such systems in place to establish those, so that we have a clear overview of the information on stocks across the supply chain. Now, once we have that overview at national level, then it's also important to have that then, let's say, merged in what we call this data lake at European level, so that that information is available also centrally. And this is what we're talking about when we refer to IT tools. And we need to have the suitable IT tools to monitor the information. And is information on stocks, colleagues have already referred to it, it's very important that we know where the medicines are and what the problems are. And also, this is why we think it's so important to understand the root causes of shortages, and the study that the European Commission is undertaking is very important. This was, for instance, done already in the United States, where they've done a study on the root cause of shortage, and that showed that the vast majority of shortages were caused were resulting of quality issues, manufacturing issues. We don't know if that is a situation in Europe. We need to understand, but we know that there is an issue with APIs. Not we're going to focus solely on the API. We know this is one of the issues. There are others, and we need to actually look at all of them and and fully understand what is the situation in Europe, which is very different certainly to the United States. We have the internal market, so we have a different situation. We need to have a clear understanding of what the root causes of shortages are, but we need to improve our IT systems. We need to be able to fully understand and have an oversight of the supply chain. And we saw that during the COVID pandemic, that we have some tools in place, but they don't give us the information that we need. So we need to work with the existing tools, but we need to further develop them so that we can have this oversight on the supply chain that we realized we didn't have during the first wave of the pandemic. And in terms of shortages as well, there, of course, if we have information on stocks, we can get information, anticipate information on shortages as well in a clear way. We've developed within the HMA Task Force on Availability of Authorized Medicines a guidance on notification of shortages by MAHs, which also allows wholesalers and parallel distributors to notify shortages. Again, there we need to find a suitable way, harmonized way across Europe for the shortages to be notified, so that we also facilitate this activity for pharmaceutical companies, wholesalers and distributors. I hope I answered your question adequately.
Thank you so much for your very detailed answer. Unfortunately, I think we are out of time. So thank you so much to all the panelists for a fascinating panel. And now the last word is for Friedemann Schmidt, the head of ABDA. Thank you so much.
Thank you, Wendeline. Ladies and gentlemen, we are coming to the close of our ABDA online conference on medicine shortages now, and this conference was held under the German presidency of the Council of the European Union. And pharmacists, as we are, among others, are warning since a long time of medicine shortages. 9 out of 10 pharmacies emphasize that delivery bottlenecks are their biggest annoyance. Medicine shortages mean a lot more work for our colleagues. On average, a pharmacist spends a whole working day per week procuring alternative products, consulting doctors if the original is not available. However, in our conference, we tried to concentrate not so much on the problem, description of the problem, but on finding solutions. In COVID crisis, the emergence of problems levels that are largely beyond the scope of national processing became particularly clear through impending or actual delivery bottlenecks for pharmaceuticals. The crisis has heightened awareness for medicine shortages and revealed even more how serious the problem is today. Therefore, at the beginning of the corona crisis, Federal Minister of Economics in Germany, Peter Altmaier, demanded that certain products, such as drugs, should be increasingly produced in Europe, or even better, in Germany. Our health minister, Jens Spahn, stepped up again in October by stating that he wanted to strengthen the European production of active ingredients and pharmaceuticals. He called policy and stakeholders to think about which instruments can be used to stimulate production and supply in Europe again. It is accordingly gratifying and consistent when there is now more talk about a coordinated European approach to health protection in the context of pandemic risks. It is accordingly logical that reducing Europe's dependence on the South and Southeast Asian active ingredients in pharmaceutical production is now on the Union's agenda. Both problems require joint efforts. However, until critical drugs and active ingredients can again be produced in Europe, if ever this will be possible, this will take quite a bit of time. In the meanwhile, the daily challenge to provide the patients with the medication they need is a local problem in our pharmacies. Pharmacists have shown in the COVID crisis that we addressed this problem very successfully. To be able to do so, we relied on national regulation that allowed us to substitute medicines without being punished by retaxations for our efforts to supply our patients. This also shows that a big part of the solution is at the national level. Therefore, national governments and health systems need a degree of freedom and the continued ability to determine the level of care they deem to be appropriate, as well as the organization and financing of the health system according to their needs, expectations, and financial abilities. The particular challenge for the planned European action will be not to overshoot the mark in view of this collective impetus. In terms of consistent subsidiarity, the diversity of historically evolved health system must continue to be respected. The integrity of a regulatory framework that is consistent in itself must not be compromised. The logic of the internal market must not be applied uncritically to healthcare. How quickly and how momentously this can happen anyway, we have seen in Germany with the question of fixed prices for prescription drugs with the European Court of Justice challenged in 2016, and the at least partial restoration cost us 4 years of hard work. It is important that the Union is flying at the right altitude. It is good if it represents and enforces European environmental and social standards in the context of globalized pharmaceutical production. It is good if it promotes the maintenance and establishment of production sites in Europe. But it would be wrong if it intervened in the complex machinery of fixed prices, discount contracts, and co-payments in the statutory health insurance in the member states. Then, according to Democritus, the most pleasant quickly becomes the most unpleasant when the right measure is exceeded. That's all for today, ladies and gentlemen. We're coming to a close now, and I want to thank you all for having been our guests today. Special thanks to all our great panelists and our wonderful host, Wendeline von Bredow, this morning. My special thanks are going to our staff, ABDA staff here in Berlin and in Brussels for organizing this conference for us. It's December the 1st, so it may be acceptable to wish you all a Merry Christmas and Happy New Year. Maybe I'm the first one who does that to you. And in these special times, take care and stay healthy. Goodbye to all of you.